Taking the time to do AED drills in your school helps to see if your plan works. It also helps to increase your communication among your staff and EMS. Drills should be performed at least 2 times each year. Today you're going to see a video broken into 3 parts. Part 1, planning your drill. Part 2, the day of the drill. And Part 3, the post-drill. Do you have a code? This code name will be used to initiate a response to a cardiac emergency by the Cardiac Emergency Response Team. The code should be communicated on the drill day and in a real cardiac emergency as defined in your communication plan. Encourage team members to be descriptive in addition to a code name and state there is a medical emergency in room blank. Include the teacher's name and geographic location. You will want to instruct your team to repeat this announcement twice to ensure rescuers hear it and are clear on location. Do you have a communication system? How will the cardiac response team know the drill has been initiated? Choose a method of mass communication to the team. For example, overhead announcements, intercoms, walkie-talkies, cell phones. Who does the drill involve? Project Adam Site Coordinator. School Cardiac Emergency Response Team. Determine if classes need to be covered during a drill or true cardiac emergency if classroom teachers are on this team. Office staff. Objective Observer. To record the times on the drill summary checklist. What will you need? AED training unit. A mannequin, a cell phone or telephone, AED drill summary checklist on a clipboard with a pen, and a stopwatch. When should a drill happen? Inform your team that you will be doing a cardiac emergency response drill in the next few weeks so they have time to review their cardiac emergency response plan in advance. Do not tell them exactly when you will do the drill. It is important once the drill is underway that it is clearly communicated to all involved that this is only a drill. Where should a drill happen? Location of drills should be anywhere on campus so all staff consider what they will be looking for. Unresponsiveness and abnormal or no breathing, and what they will do. If students are on campus, be sure they are informed beforehand about what the drill may look like and that it is only a drill. The video you are about to see is a team in a school setting working through a cardiac emergency response drill.
Oh no! Annie, are you okay? Are you okay?
This is the office.
Hello, this is Mr. Lee in the choir room, and I'm going to need the E-team.
And what is the student's name?
The student's name is Annie Smith.
And their grade?
She's a 7th grader.
And what is the problem?
She is unconscious. I'm not sure if she's breathing.
All right, we'll send help. E-team to the choir, room 325. E-team to the choir, room 325.
Are you okay? Are you okay?
Are there any signs of life?
No signs of life. Begin compressions.
Call for help now.
16, 17, 18,
Remove all clothing
Hey, Mary, I'm gonna
from
cut the shirt.
patient.
Okay, just remember the yellow pad
Red
goes in the
handle
right.
to open bag.
Closest to you. No,
Closest to you. There you go.
That goes lower.
Look at pictures on pad. Do not touch patient. Evaluating heart rhythm.
Everybody back up, back up.
Stand by. Preparing to shock.
Everybody back up, we're gonna shock.
Everyone clear. Press flashing button. Shock delivered. Provide chest compressions and rescue breaths.
1, 2, 3, 4.
6, 7, 8.
The ambulance will be here. I'll meet them at door 18S.
13, 14, 15, 16, 18, 19, 20, 21, 22, 23,
Continue care.
25, 26, 27, 28, 29, 30.
I got the next one, Brad.
1, 2,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1, 2.
Continue care.
2, 3, 4, 5, 6, 7.
Everyone
9.
clear.
Back
Touch
up,
patient.
back up. Everybody back up.
Evaluating heart rhythm. Everyone clear. Press flashing button.
Everybody back up. Shocking.
Shock delivered. Provide chest compressions and rescue breaths.
1, 2, 3.
So let's review what we just saw. The site coordinator should place a mannequin on the floor and have the AED training unit available when the real unit arrives on the scene. Switch out the training unit for this experience. Have the first person on the scene call the front office advising them that this is only a drill. Tell them you have an unresponsive victim and give your location. Your plan now goes into effect. The school's cardiac emergency response team should be notified using the established code, for example, code blue, using the team's established communication system. The goal is to complete the AED drill in under 3 minutes, from the person falling unresponsive to the first AED shock. If this is your first AED drill, your designated observer should record a checklist summary of yes/no responses to ensure the core response standards are in place using the AED Drill Checklist 1. Once you've completed your first drill, your designated observer should record a checklist summary of responses to ensure all core response standards are met in under 3 minutes using the AED Drill Checklist 2. Both checklists are found on the Project Atom website. The site coordinator gives the first rescuer to arrive, Rescuer 1, a short scenario. The AED training unit is already placed at the drill location, ready to be swapped out with the real school AED, which is brought to the scene. Never use the real AED for drills. Proceed as if this is a real cardiac arrest situation. Post-drill. Thank everyone for responding. Spend a few minutes reviewing the checklist together, noting times and duration of different steps of the response. Ask the rescuers for feedback and discuss suggestions and concerns. Celebrate what you did right. Consider whether there are any action steps needed. Were there specific communication problems? If the drill points to changes to the plan and protocol, discuss these with your cardiac emergency response team and administrator. Be sure to make the changes and communicate the changes clearly to your team. Plan another drill to test the revised plan.
Thank you so much for being part of the team here at JRG. We'd just like to talk to you a little bit about doing drills in your district. What have you learned from doing AED drills in your schools?
I think the thing that I've learned the most about doing drills is just how to react in an emergency response situation. You know, when you react in an emergency response, there's a lot of anxiety that comes along with that. And so having the opportunity to practice and practice often helps reduce that anxiety so that we know what to expect. Every situation is different, and so each time we learn something a little bit different.
And that's where our nurses do a great job training us for every situation that could occur. For example, we had a drill one time, we're out on the turf, you know, we have to react, our AED is in a shed out there. And then also we had a situation where it was a bee sting situation, so we had to react and think quick enough and get the EpiPen, which was awesome learning experience because we've never had a drill like that before.
I think also it gives us an opportunity to know not only what we have to do as responders, but then what we do with our students if the situation were to happen in a classroom full of kids. You know, we know how to react as an adult, and we also know what to do with the kids to try to get them out of harm's way and make sure that they're in a safe environment too, and to protect the identity of the person that's, you know, maybe going through the emergency, to help them along too.
I was going to say, we have no idea whether it's a drill or a real situation. So when we hear E-Team report to this room, we're acting as if it's a real situation because we honestly have no idea what we're basically walking into.
Mm-hmm.
That's great. What advice might you have for other schools that haven't done a drill?
I would definitely say you need to start doing it because the more we do the drill, the more relaxed you are because you're comfortable in the situation. You've done it enough, so it's not something where, you know, obviously anxiety will kick in a little bit, but being trained and having time to practice the drills have been beneficial for our school.
Yeah, and I think each time that we do it, we get a little bit better. Our response time gets better. And like I said earlier, sometimes things happen that we don't expect. Some things, you know, go differently than expected or in the past, and so then we can talk a little bit about that and debrief afterwards and make sure that we have everything polished and ready to go for the next time.
And it's good to practice because every time you attempt a drill, your role in that situation could be different. You know, this drill, it could have been I was on the AED, she was doing the compressions. Every drill, you might be in a different role, so the more you practice it, the more comfortable you become in every single role that you could have.
And I also like the fact that our administration really supports this programming and supports our drills and makes sure that the staff that reports is up to speed and they know what to do in every situation.
And the district offers summer courses throughout the year. Our nurses do a great job. If you wanted to get trained, they would make the time to train you in it.
Is there anything else you would like to add?
I'd just like to say that because of this training, I had a situation this summer in which I had to, in my head, I was thinking, check, call, care. I saw someone get in a moped accident. I could see the blood coming from the back of their head. And in my instinct at that motion, or that time, was that I wanted to go care. I had my cell phone in my pocket. I knew because of these drills, they're going through my head, check, call, care. I saw what was happening. I knew my next step was to call.
Thank you so much for your involvement with the Project Adam Heart Safe School designation. I had an opportunity earlier today to watch your emergency team in action as they did a cardiac drill. From an administrator's perspective, could you tell me what you've learned from doing drills in your district and how they benefit your staff?
Yeah, it's a great question. I think you know, one of the things we always look at in a school is creating a safe environment, and so we really look at our heart safe drills as part of that safe environment. I think it's important for us to send the message that you know, the health and well-being of our staff and students is critical, and so we really look at our heart safe drills as part of that safe environment. I think people feel more prepared if we are drilling on a regular basis and providing time for that. I also think it sends the message that these are important things, and that even though it's not likely to happen, and we hope it doesn't happen, we need to be prepared in case it does.